Let's talk about the regulation of cardiac output, the amount of blood your heart pumps each minute. Cardiac output, or CO, is the volume of blood ejected by each ventricle per minute. It depends on two main factors, heart rate and stroke volume. Heart rate is the number of beats per minute. Stroke volume is the amount of blood pumped with each beat. The formula is simple. Cardiac output equals heart rate multiplied by stroke volume. At rest, the average heart rate is about 75 beats per minute, and the average stroke volume is about 70 milliliters per beat. Multiply those together, and cardiac output is roughly 5.25 liters per minute. That means your entire blood volume, about 4 to 6 liters, circulates through your heart every minute. But cardiac output changes depending on activity level. During vigorous exercise, it can rise dramatically, up to 21 liters per minute, to meet the body's increased oxygen demands. Now, let's look at heart rate more closely. Heart rate is commonly measured by taking a pulse where an artery lies close to the skin. You can count the beats for 15 seconds and multiply by 4 to estimate beats per minute. When the resting heart rate stays above 100 beats per minute, it's called tachycardia. This can be caused by stress, anxiety, stimulants, fever, or heart disease. When the resting heart rate falls below 60 beats per minute, it's called bradycardia. This is common during sleep and in endurance-trained athletes. Low body temperature, or hypothermia, can also slow the heart. Factors that affect heart rate are known as chronotropic agents. Positive chronotropic agents increase heart rate, while negative chronotropic agents decrease it. A major regulator of heart rate is the autonomic nervous system. The sympathetic division stimulates the heart. Signals from the cardioacceleratory center travel down the spinal cord to the upper thoracic segments, from T1 to T4. From there, nerve fibers form cardiac nerves that reach the heart. These fibers influence the SA node, the AV node, the atrial and ventricular muscle, and even nearby blood vessels. Sympathetic stimulation increases heart rate and strengthens contractions. The parasympathetic division slows the heart. Preganglionic fibers travel through the vagus nerve and enter the cardiac plexus, where they synapse with short postganglionic fibers. The right vagus nerve mainly targets the SA node, while the left vagus nerve primarily influences the AV node. Some fibers cross over to affect additional areas. Together, sympathetic and parasympathetic inputs continuously adjust heart rate and cardiac output to match the body's needs. And that's how cardiac output is regulated, through the balance of heart rate, stroke volume, and nervous system control.